The January 4, 2011 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Ms. Andrews? Mr. Daniele? Ms. Cayley? Mr. Lightfoot? Dr. Quattro? Mr. Rocco? Chairwoman Draw.
Here. Is there anyone at this time who signed up to speak?
There are no public forum speakers today.
And is there anyone that would like to speak? Okay, thank you. The next item on the agenda is the approval of minutes. You have before you the November 30th, 2010 minutes. They will stand approved unless the clerk is notified by any changes at the end of the day. Next item on the agenda is new business. Madam Clerk.
Referral 10-380.
Moved by Legislator Rocco, second by Legislator Quattro. Is there any discussion? Legislator Andrews.
Thank you, Madam Chair. Through you to the administration, could someone just explain the purpose of this referral and what will actually be happening with the third-party health insurance billing service at the hospital?
Through you, Madam Chair. I'm Todd Spring, Executive Director of Monroe Community Hospital. There are changes in law in 2010 created an opportunity for MCH to bill separately for physician services, which were historically part of our all-inclusive daily rate. So we need now to create an infrastructure to set up the actual billing for physician services for all the residents at MCH. And this service, after extensive evaluation, versus hiring a staff member or contracting it out, we concluded very clearly that it's to our benefit to engage a third party to do this billing for us.
Thank you. And can you explain through the chair who Beth Platt is and what her experience is in working with the hospital-based medical groups, please?
Yes, again, through the chair. Beth Platt and Associates is a firm been in business for 21 years. It's currently a 25-person firm that does billing for right now 11 other nursing facilities in town, 20 private physicians groups, and several regional smaller hospitals.
Thank you. And through the chair, how much are the expected billings?
Through the chair, you mean how much do we anticipate billing out, or her fees?
Billing out.
Billing out, we anticipate in excess of $1.1 million in physician services.
Thank you. And will the billing be done electronically through the chair?
Again, through the chair, there is a paper form that we fill out, the physicians will fill out on the units. They then are transmitted to the billing service, and then the bills are electronic to the insurance companies.
Thank you. And through the chair, can you approximate what percentage of the patients at MCH are dual eligible for both Medicare and Medicaid?
Through the chair, let me do quick math. Roughly about 65% are dual eligible.
Thank you. So if I understand what you said correctly, that until 2010 there was no need for the hospital to do this at all, but as of 2010 now it is something that is necessary because of the changes in the law. Is that correct?
Through the chair, that is correct.
Okay, thank you. Those are all the questions I have at this point in time. I do think that some of my other colleagues may have other questions at Ways and Means Committee. Thank you.
Is there any other discussion? All those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-381.
Moved by Legislator Quattro, second by Legislator Daniele. Is there any discussion on this? Seeing none, all those in favor signify by saying aye. Opposed? Any opposed? Item carries. Next item.
Referral 10-382. Acceptance of funds.
Moved by Legislator Daniele, second by Legislator Rocco. Any discussion on this? Legislator Lightfoot.
Yes, thank you, Madam Chairman. To the administration, thank you. Some of the agencies fell well short of their goals in 2009-2010 year. Are there allocations being reduced through you, Madam Chairman, to the administration?
Corinda Crosdell, Director of Monroe County Office for the Aging. You're referring to our nutrition programs?
Yes.
They're not being reduced in regards to funding through the chair. We are going to reevaluate how they provide services and see if we can't increase their success rate on their objectives.
Okay, through you, Madam Chairman, some of the agencies that are flat funded, what incentives is there to perform? Are there incentives in place through you, Madam Chairman, to the administration for these agencies?
Through the chair, their funding is based on available funding from the state. So increases and decreases in funding not only are attached to objectives and meeting those goals, but also on the amount of funding that we receive from the federal and state government.
Okay, thank you.
Any other discussion? Legislator Andrews?
Thank you, Madam Chair, and through you to Ms. Crossdale. You indicated regarding the nutrition programs that some of the programs that are failing to meet their goals are going to be reevaluated. Can you just elaborate on what that process will look like during this year?
Through the chair, we just hired a new contract monitor. So he'll be meeting with the various coordinators of the nutrition programs, and we're also going to be doing joint planning with the coordinators, and our first meeting with them will be actually January 7th. So we'll monitor them a little more closely throughout 2011.
Thank you. Would it be your expectation then that if they continue to not achieve their goals that they would receive a decrease in funding in future years?
Through the chair, it depends on where the funding is being spent. If it's on meals, if seniors are still needing and wanting those meals, we would not reduce that portion of the funding. We would take a look at recreation and education, and if they're not meeting their goals, we would ask them to adjust what they're doing, and we would only pay according to the adjustments made to the program.
Okay. Thank you very much.
Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-383.
Moved by Legislator Rocco, second by Legislator Quattro. Any discussion? Legislator Cayley.
Chair, through the chair, are there employers, well, we're going into the second year of this funding. Are there already other employers identified for this funding, or will this continue with the previous employers?
Through the chair. I'm Nancy Forge, Director of Financial Assistance for the County Department of Human Services. We are always looking for additional employers, although at this time the employer force that we have for this grant appears to be sufficient for the identified recipients.
Thank you. So if I'm understanding, there, at this point, what you have is sufficient for the funding coming in. You wouldn't be looking for anyone else.
We're always open. We have other opportunities to place public assistance recipients into subsidized employments. We have TEAP, Temporary Employment Assistance Program, that the state also operates.
Thank you.
Any other discussion? Legislator Andrews?
Thank you. Can you, through the chair, could you say who the employers were for the first year of this program, where you placed folks?
Through the chair, I did not bring the entire list with me. There were 26 different employers that we utilized. The healthcare employers were, for the most part, the hospitals in the community. We placed a large number of people through, right, Career Start is our vendor that found and contracted with the employers. But I'd be happy to get you the full list of employers that we use for placements.
That would be fine if you could follow up with me, and if you could provide that list for not only this referral but the subsequent referrals that are very similar in nature.
Sure.
Through the chair, how many workers were placed in this program, both the Transitional Jobs one and then as well as the Green Jobs Corps and the Healthcare Jobs Program last year?
We don't have, through the chair, a comprehensive list at this time because claim vouchers would still be coming in on this year's grant funding. I had prepared a spreadsheet for the committee. We had placed 458 individuals into employment from the transitional and healthcare jobs through October 31st of this year, and 46 through the Green Jobs Initiative.
Thank you. And through the chair, do you know what the approximate average wage was for those jobs?
Through the chair, the approximate average wage was $9.33 an hour, I believe.
Thank you. And do you know if the average job came with health insurance benefits, or are most of these non-job or positions without
Through the
benefits?
chair, I am not sure about the health insurance benefits for those.
Okay. In looking at the funding levels for this referral 383, it appears to be a pretty significant cut in funding for this program of almost $1 million, which, unless there are other referrals that go along with this, it would almost eliminate the program just down to that funding level of $230,000. Is that accurate, or is there funding that we've already accepted to support this program?
Through the chair, that's accurate. The initial year's funding was supported by federal stimulus funding that's not available to New York State going into this funding year.
Thank you. And through the chair, what do you expect to happen then to the over 500 folks that were placed in these positions? Do you anticipate they'll be able to keep their positions, or if the subsidized funding goes away, will they lose them?
Through the chair, yes, we anticipate that the great majority of these placements will continue to be successful.
Through the chair, just following up on that, successful in the same positions, or just successful having to find new positions?
Through the chair, successful in the same positions. Career Start has been very proactive in assisting clients who failed at the initial employment placement and finding them a different placement that might be more in line with their skill set. So they have committed to us, Career Start, that any failures in employment through this program, they will work to find new jobs.
Great. Thank you, Ms. Forge. And if you could just follow up with me and find out what number of those jobs came with health care benefits, that would be appreciated. Thank you very much.
Sure. Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-384,
Moved by
acceptance.
Legislator Quattro, second by Legislator Daniele. Any discussion? Legislator Lightfoot.
Thank you, Madam Chairman. Through you, Madam Chairman, are there any companies that are in line to receive employees funding from this program? And if so, through you, Madam Chairman, who are they?
Through the chair, companies, it's actually the employee that is subsidized, so we're not necessarily targeting companies to receive the benefits. I just wanted to clarify that. Most of the placements for the green jobs have been, it's through Rochester Landscape Technicians, yes.
Okay, thank you.
Deconstruction and trying to think of the appropriate term these days. Well, there is window replacement, weatherization.
Oh, nice. To you, Madam Chairman, so these individuals that are going from they're getting these job skill training and basic education in these programs, are they leaving with some form of certification in this field with this landscaping company?
Through the chair, I believe that they are, but I'll double check on that.
Okay, thank you.
Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-385, acceptance
Moved by
of grant.
Legislator Daniele, second by Legislator Rocco. Any discussion on this? Legislator Cayley.
Thank you, Madam Chair. Just a quick question on the, does this grant work basically much like the other two that we were just talking about, where the individual itself is subsidized and then placed in a nursing home, hospital or nursing positions? Or is this a different type altogether?
Through the chair, I may have misrepresented that we're not,
You're not placing?
the individual is not subsidized per se, but the employer is not receiving a grant subsidy, I guess is what I'm saying.
Yes, I
Is that
understand.
clear?
I just
Okay.
parroted back, and I did understand the concept, but
Okay.
I said it badly. Then through the chair, are we talking about roughly the same type of program here?
Through the chair, yes, we are.
Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-386.
Moved by Legislator Rocco, second by Legislator Quattro. Is there any discussion on this? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-387, acceptance.
Moved by legislator Quattro, second by legislator Daniele. Any discussion on this? Legislator Andrews.
Thank you very much. This referral's purpose is apparently to reduce the staff-to-client ratio in the Child Protective Services area. My first question is, what is the current staff-to-client ratio, and then what is the targeted goal for that ratio?
Madam Chairwoman, the title of the grant is to improve the staff-to-caseload ratio. We use this grant funding to support a specific overtime project to reduce the number of overdue CPS investigations. We can tell you for the next meeting, and certainly before the legislative vote, the current number of overdue cases and the goal we have. Actually, Madam Chairwoman, I believe I do have that information at hand. This grant funding will allow our child protective investigation staff to reduce overdue caseloads at least by 5% each month from November 2010 through March of 2011. I don't have a hard number of how many overdue cases there are, but if the legislator would like that information, we can report back certainly by the legislative vote.
Thank you. Yes, that'd be interesting to see. Through the chair, what accounts for the large decrease in funding for this program?
Madam Chairwoman, the major factor for the reduced level of funding is simply a statewide designation for this initiative. And with a reduced statewide allocation, each district that is receiving an allocation is receiving proportionally less.
Thank you very much.
Thank you. Any other discussion? Legislator Cayley.
Thank you, Madam Chair. If this current grant, the expectation is to reduce or improve the client-to-staff ratio of 5%, can you speak to the results of the last grant, being that it was larger? Are we catching up, or are we just holding our own?
Madam Chairwoman, I believe it was 2 years ago that we received the first-year grant award. Perhaps 2.5 years ago, the Department of Human Services was able to add CPS investigative staff with that funding. And the Services Division did remarkably well in catching up and reducing their backlog of overdue cases. This particular grant funding will support an overtime project. It does not come with additional staff. But as has been reported during the budget hearings of last month and the committee meetings in November, the number of calls from the public and mandated reporters to the CPS hotline has dramatically rose over the past several years. This is not just a local phenomenon, but a statewide and national phenomenon. The number of cases really seems to be skyrocketing. The percentage of cases that are indicated is remaining the same. But we have done more than hold our own, with a short answer to the question. But we still have a ways to go.
Thank you. I didn't mean to imply that when I meant holding your own, I meant as a community as a whole. Certainly not a reflection on staff, because I think that you, it's evident that you work very hard to serve the citizens of Monroe County. So I didn't mean to imply that it wasn't being done correctly or well enough. It's unfortunate that the funding is reduced, because if the incidence is going up, it's going to take even more work to hold our own, and I expect that that's what staff will be doing and our employees will be doing anyways. So
Yes,
thank you for your work.
Thank you. Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Is there any other new business to come before this committee this evening? Seeing none, then the January 4th, 2011 meeting of Human Services will be adjourned, and the next meeting of the Human Services Committee is scheduled for January 25th, 2011, 6 p.m. Thank you.